And she was actually jumping, saying, "Yay, vaccines!" Because she knows that, we all want that for her, and she understands that it's protection for her.
An Edmonton mom expresses joy that today Health Canada has approved Moderna's COVID-19 vaccine for young children under the age of 5.
She has no memory of what it's like to be in a restaurant. In fact, she's only been on a patio maybe 3 times.
The mom of 2 says they've had to sacrifice eating at restaurants to protect her unvaccinated 4-year-old, and that the long wait for this vaccine has made her feel disregarded by the government as a parent of a young child.
Feels like an eternity, especially because the protections were removed so early in this province in particular. It just kind of felt like we were all just left on our own.
Following all those regulations and meeting the scientific data takes some time. And I think that should be reassuring to families and caregivers that those processes were followed and there wasn't anything rushed in making sure that this vaccine is safe and effective for children.
The pediatrician and mom of a daughter who's almost 3 says vaccination is important to prevent serious illness or hospitalization in young children.
And I have seen serious illness in children who are healthy, who get COVID.
Alberta trails behind all other provinces when it comes to COVID-19 vaccine coverage. Only 50% of the 5 to 11 age range category in Alberta have at least 1 dose. 36% have 2. Will this reluctance continue with the under 5 age group? Some Canadian parents responded to the news on Twitter saying, "No thanks, I'll let my kids' immune system develop naturally, thanks." One said, "Leave our kids alone, no thanks." And another parent asked, "What is the risk of long-term yet unknown side effects of this versus the risk of a bad outcome from COVID for a child?" Those concerns are addressed and contradicted by most doctors.
The vaccine itself has been rigorously studied, and the side effects that we've noted have been relatively mild, whereas the infection itself we know can cause severe illness, and we don't know what the long-term consequences are of infection on children.
Alberta Health tells City News in an email that they expect to receive an initial supply of the vaccine and begin rollout by the end of July. In Edmonton, Sarah Chu, City News.